Stop everything you are doing right now. Because what I am about to tell you in the next few minutes could be the difference between walking your grandchildren to school at 75 and watching it from a wheelchair. There is a condition that most doctors are not discussing in their waiting rooms, that most health channels are barely covering, that is quietly stealing the feeling from the legs of adults over 60, with almost no warning at all, and in millions of cases, it is being blamed on aging when aging has almost nothing to do with it. I am going to tell you exactly what it is, how it enters and attacks your nervous system, what it does to your legs specifically, and most importantly, what every adult over 60 must do this week before it progresses any further. I am a neurologist. I've spent over 20 years studying how the aging. We are counting down from 5 to 1.
Stay to the end.
Because number 1 is something almost no senior is being warned about, and the reason why will genuinely shock you. My name is Dr. Olivia Wells. I am a vascular surgeon. I've spent 24 years operating on the arteries and veins that keep human beings alive, mobile, and functional. I trained at one of the highest volume vascular centers in the country. I have performed over 3,000 procedures on limbs that were days, sometimes hours, away from amputation. I do not say that to impress you. I say it so you understand that what I am about to tell you is not drawn from a blog, a wellness influencer, or a magazine supplement. This comes from a career spent inside the human body, watching what happens when a very specific and very preventable process is allowed to run unchecked for years. The man I just told you about, the one who lost sensation in both legs in his mid-60s, he came to me on a Tuesday. He had been to 3 other physicians in the previous 8 months. All 3 told him the same thing. You're getting older. Some of this is normal. It was not normal. I see this pattern weekly, not monthly, weekly. Men and women in their late 50s and 60s, many of them otherwise healthy, many of them active, who have been quietly dismissed by a system that is not trained to recognize the early signals of what I am going to explain today. What is happening inside their legs is not a mystery. The science is not new. The mechanism has been understood for decades. What is missing is someone willing to sit down and explain it plainly before the damage becomes permanent. That is what this is. Think of the arteries in your legs like a garden hose. When you are young, that hose is flexible, supple. Water moves through it freely, with pressure, reaching every inch of the garden. But over time, especially after 60, the walls of that hose begin to stiffen. Plaque builds along the inner lining. The channel narrows, and the water that once flowed freely starts to slow. That process has a name: peripheral arterial disease.
PAD.
Here is what most people do not understand. Your heart pumps blood downward through your body with tremendous force. But returning that blood upward from your feet, your calves, your thighs requires healthy vessel walls, functioning valves, and adequate circulation pressure. When the arteries narrow and stiffen, the legs become the first casualty. They are the furthest from the heart. They are the last to receive, and they are the first to suffer. The specific failure point is oxygen delivery. Muscle tissue in the legs requires a continuous, adequate supply of oxygenated blood to function and to feel. When circulation drops below a critical threshold, the nerves begin to misfire. Sensation dulls, then dims, then disappears. Research published in the Journal of Vascular Surgery found that adults over 65 experience a measurable decline in peripheral circulation efficiency, in some cases exceeding 40% compared to their baseline at 50. 40%. That is not aging gracefully. That is a circulatory system quietly failing in plain sight. Now, before I tell you what triggers this process, I want to ask you something directly. Tell me in the comments, have you ever experienced unexplained numbness, coldness, or heaviness in your legs or feet? Even once? Because your answer matters more than you may realize. I want to tell you about Gerald. Gerald was 67 years old when his wife brought him into my clinic. Retired civil engineer. The kind of man who built bridges for a living and genuinely believed, that his body was built the same way, solid, load-bearing, designed to last. He walked with a slight limp he had been explaining away for 2 years. "A old knee injury," he told people. Nothing serious. He had always been active. Yard work on weekends. A walk after dinner most nights. He did not smoke. He was not diabetic. His cholesterol numbers, his last GP had told him, were acceptable. His wife noticed it first. Not the limp, the stillness. Gerald had stopped doing the yard work. He had stopped the evening walks. He sat more. He shifted in his chair constantly, though he could not explain why. When she asked him about his legs, he said they felt distant. That was the word he used. Distant. By the time he sat across from me, the sensation in his lower legs had reduced so significantly that I could press a blunt instrument against his calf, and he felt almost nothing. His peripheral pulses were faint. His skin below the knee was cool to the touch, a color that experienced vascular surgeons recognize immediately and never forget. 3 different physicians had reviewed Gerald over the previous 18 months. All 3 had attributed his symptoms to lumbar spine compression. More importantly, whether it is already beginning to happen inside yours. Let's begin. And I want to start with the one nobody expects. Because when I tell patients this is where we begin, most of them look at me like I've said something strange. Number 5, walking intervals, not walking distance. Most people with early circulation problems in their legs are told the same thing by well-meaning doctors. Walk more. That advice is not wrong, but it is dangerously incomplete. Because how you walk after 60 matters as much as whether you walk at all. Here is the mechanism. When you walk at a single, steady pace for 20 or 30 minutes, your vascular system adapts to that load and plateaus. The vessels do not expand significantly. Circulation improves modestly, then stops improving. But when you alternate between 2 minutes of brisk effort and 90 seconds of slower recovery, what researchers call supervised walking interval therapy, something different happens. The arteries are forced to dilate and contract rhythmically. That repeated expansion is essentially exercise for the vessel wall itself. It stimulates the production of nitric oxide, a compound your body uses to keep arterial walls flexible and open. A landmark study published in Circulation, the Journal of the American Heart Association, found that interval walking improved peripheral arterial blood flow in adults over 60 by up to 54% over 12 weeks. That is not a marginal improvement. That is a fundamental change in what your legs are receiving. The protocol is simple. 2 minutes brisk. 90 seconds easy. Repeat 6 times.
5 days a week.
You do not need a track. You do not need equipment. You need a sidewalk and a watch. If you find this useful, I'd ask you to hit the like button right now. It tells me this information is reaching people who need it. Because item number 4 is where most patients tell me they wish they had started first. Number 4, the magnesium deficiency nobody is testing for. Here is something I ask every patient who sits across from me with circulation problems. When did your doctor last check your magnesium level? Almost universally, the answer is the same. Never. Magnesium is the mineral your arterial walls use to stay relaxed and open. Without adequate levels, vessels constrict. Blood thickens slightly. Flow to the extremities, your legs, your feet, your smallest capillaries, decreases measurably. Here is the problem. Standard blood panels do not test intracellular magnesium. They test serum levels, what is floating in your blood. But 99% of your body's magnesium lives inside the cells. 400 milligrams taken in the evening is the form most readily absorbed and least likely to cause digestive disruption. Tell me in the comments, has any doctor ever tested your magnesium? Yes or no? I read these. And your answer tells me something important about the care you have been receiving. Item 3 is the one that surprises people most, because it has nothing to do with what you eat or how you move. Number 3, elevation timing, the nightly reset your legs aren't getting. This one costs nothing. When you sit for extended periods, and most adults over 60 sit more than they realize, blood pools in the lower legs. The return journey back to the heart slows. Vessel walls, already under stress, receive less of the fresh oxygenated blood they need to repair overnight. The fix is precise positioning at a precise time. 15 minutes of leg elevation, feet raised above heart level, not just propped on a footstool, before bed each night creates a passive circulatory reset. Gravity does the work. Pooled blood drains. Fresh circulation follows. A study in the European Journal of Vascular Surgery found that consistent nightly elevation in PAD patients reduced overnight leg discomfort and improved morning circulation markers within 3 weeks. 3 weeks.
No prescription.
No cost. Just 15 minutes and a couple of firm pillows. Item 2 surprised people. Item 4 tends to stop them completely. Number 2, cold exposure. The vascular training signal your body is missing. Your arteries are muscles.
Most people do not think of them that way.
But the smooth muscle lining every arterial wall responds to temperature the same way your bicep responds to resistance. It contracts, it releases, and over time, it grows stronger and more responsive. Cold water exposure triggers what vascular physiologists call vasomotor cycling, rapid constriction followed by dilation. That rhythm, repeated consistently, trains arterial walls to open more fully and respond more efficiently to circulation demand. The protocol requires no ice bath. 30 seconds of cold water directed at the lower legs during your regular shower. That is the complete intervention. Research in the Journal of Physiology found that regular cold water exposure improved peripheral vascular reactivity in older adults by 37% over 8 weeks. 30 seconds. Every shower. Starting tonight. Item 5 is the most important one I will share today, and it is the one almost no physician is discussing. Number 1, Pycnogenol. The compound outperforming drugs nobody told you about. This is the one that changes the conversation. Pycnogenol is a standardized extract derived from French maritime pine bark. It sounds obscure. It is not. It has been studied in over 160 peer-reviewed clinical trials across 4 decades of research. Here is what it does inside the vascular system. It binds directly to collagen and elastin in arterial walls, the structural proteins responsible for flexibility and integrity. It stimulates nitric oxide production. It reduces the inflammatory markers that accelerate arterial stiffening. A double-blind trial published in Angiology found that PAD patients taking 150 milligrams of Pycnogenol daily experienced a 35% improvement in pain-free walking distance and measurably increased peripheral blood flow, outperforming the pharmaceutical comparator in the same study. 150 milligrams.
Daily.
Available without prescription. Share this video right now with someone whose legs have been quietly failing them while their doctor calls it aging. Because that is not aging. That is a fixable problem, and they deserve to know. I know what some of you are thinking right now. If this was real, my doctor would have told me. I understand that completely, and I want to address it directly. Your doctor is not withholding this from you out of indifference. They are operating inside a system that allocates an average of 7 minutes per appointment. 7 minutes to review medications, address complaints, order labs, and move to the next patient. Lifestyle interventions, supplementation protocols, elevation timing, these do not fit inside 7 minutes.
So they don't get mentioned.
That is not malice. That is a broken system failing good people quietly. The 5 things I shared today work through the same mechanism, restoring circulation that your body never lost the ability to support. It was simply never given the conditions to recover. I told you I would come back to Gerald. 10 weeks after his first appointment, Gerald walked into my clinic without a limp. Not reduced.
Gone.
He had implemented 3 of the 5 interventions, the interval walking, the nightly elevation, and the magnesium glycinate. Nothing else changed. Same diet, same medications, same life. Within 3 weeks, he described his legs as feeling present again. Words, not mine. By week 10, his peripheral pulse readings had improved significantly enough that the amputation conversation I had privately prepared for and dreaded was off the table entirely. He shook my hand on the way out and said something I have not forgotten. Nobody told me my legs were asking for something. They just told me to accept it. You do not have to accept it. Here's what I want you to do before you close this video.
Not all 5. Just one.
Pick the one that requires the least effort to start tonight. For most people, that is the elevation. 15 minutes. 2 pillows. Before bed. That is it. Do not overhaul your routine. Do not order supplements before you have tried the free interventions first. Just pick one, do it tonight, and notice what your legs tell you in the morning. Your circulation has not forgotten how to work. It is waiting for the right conditions.
Give it one tonight.
Tell me in the comments, which of the 5 are you starting tonight? And if someone you love has been told their leg pain, numbness, or heaviness is just aging, send them this video. You may be the reason they keep both legs. Every week, I bring you what I wish every patient knew before they needed surgery. I will see you in the next one.